Spotlight is a production of CTNY, the Catholic Television Network of Youngstown. It seeks to spotlight people, places, and events from around the Diocese of Youngstown that promote the new gospel of joy called for by Pope Francis. Your program host is Father James Corda.
Hello and welcome to this edition of Spotlight. I'm Father Jim Corda. Today we're going to talk about Hospice of the Valley. And joining me is Rosemary Antonucci, who is the volunteer manager there. It's a pleasure to have you on the show today.
Thank you, Father. Thanks for being here.
It might be a nice idea for the folks that are with us to give a little background into hospice, a little history of how it started, and particularly here in Mahoning County.
Sure. Hospice was actually started by the National Federation of Jewish Women. And so back in 1979, a group of women got together and said, we really need this service in our community. So that was our initial grassroots start. Back then we were actually known as Hospice of Youngstown. And approximately in 1992, the director at that time, Mr. Paul Easton, was more of a visionary and tried to expand our services. And so we eventually became aligned with Humility Mary Health Partners, which is currently now Mercy Health, and we began to grow. And in Ohio, we serve 3 counties, Mahoning, Columbiana, and Trumbull counties. And within the past few years, we've actually expanded into Western Pennsylvania, covering the counties of Mercer, Lawrence, Butler, and Beaver counties.
Now, as you've grown, have you seen the need for hospice grow as well?
Absolutely. Not only has the acceptance of the hospice concept become more acceptable and certainly more welcomed, but there are various hospices in the communities as well, both in Ohio and Pennsylvania.
Now we know that obviously having hospice is a tremendous gift in the area, but when people hear of hospice, sometimes there's almost like a sense of foreboding, like this is the end, but yet it's also kind of a beginning. It's a preparatory to what we believe is a new life beyond this. So what are some of the driving principles behind hospice that they impart to the clientele or to the patients that they minister to?
Well, first and foremost, we believe that the hospice concept is designed to provide end-of-life care. And typically, that would be a life-threatening or life-limiting disease of a life expectancy of 6 months or less. That is typical on average. And also, through those last months, through the journey of the last few months of that patient's life, hospice is able to provide comfort not only to the patient, but to the family. And we believe that that's so important. And it's not that they're giving up, but we feel we provide hope and support through those final days.
You know, it's really important, as you had mentioned, to provide it to the families, because oftentimes, you know, it's the person that's dying that an institution ministers to, but the support people that are there that are really suffering with them need as much support as well. And so I'm really glad to hear that that's part of the objective. And in your experience of ministering to the people who are part of the hospice program, anything that stands out insofar as a story or an experience that typifies what exactly hospice does for someone who is in the program that is dying?
Well, I think what's important to note is that we have a whole team of professionals that help both the patient and the family. The emphasis is, of course, on pain control and comfort. And certainly when the patient is comfortable, that alleviates some of the anxiety of the patient's caregiver or family members. So every patient is blessed by having a physician, a team of nurses, the personal care team, someone that can come in and assist with bathing or bathe the person. We have social workers that help with the emotional and psychological issues that they may be facing. We offer chaplaincy to all of our patients as well as volunteers, and we do believe that the volunteers offer a key role as well.
We're going to talk a little later on about the volunteers because that really is an important facet of the organization. I'd like to go back to the terminally ill themselves. How does hospice determine that someone needs their care at this point? Is that a referral from a doctor, or how does that work?
Actually, anyone can refer to hospice. So a family member can call and say, you know, the doctors told me there's no further treatment available for my loved one. I think we would like to have hospice. The physician's office can call. The important thing is, the patient themselves can actually call us, but the important thing is that once that initial contact is made, we must have a physician's order because, of course, all the care is prescribed by the physician.
So in other words, someone doesn't go back to a hospital and encounter doctors for prolonged life. Does that make sense to say that?
Yes.
Okay.
Once a determination has been made by the physician and or the patient directly, the patient can simply say, I've had enough, I don't want to go through aggressive treatment. Let nature take its course.
And I, in my own experience in ministry, have witnessed that on many occasions. And there's almost a sense of peace that happens when someone enters the hospice program because they see the overall care that's taking place. Not only are they cared for and their immediate needs met, but their families as well.
Absolutely.
And so it's not like they're in it alone anymore. And I think that's kind of a sense that, at least probably in your experience as well, those who are terminally ill have. There's a sense that I'm in it by myself, but they're really not.
They're not.
You know?
Again, going back to our interdisciplinary team, let's say that we have a particular patient that is experiencing a lot of anxiety because perhaps they have pulled themselves away from their church or their faith background. We can offer private chaplain visits. They can discuss that one-on-one with a chaplain who does not push their religion, but simply is there to minister to that patient. The same thing, the patient may share something with one of the nurses, and the nurse would recognize that perhaps a social worker should come and visit this patient and discuss those feelings and those planning needs. Maybe it's a gentleman that's really worried, how is his wife going to survive without him financially, emotionally, physically? So often perhaps, each of us falls into a certain role within our marriage or within our life, and he may be worried about that. He might be worried about his dependent children. And
those are all very realistic issues that a terminally ill person will have, and to kind of calm those and also to give answers to those is really an important part of it, and I appreciate you saying that. We're going to take a break in a moment, and when we come back, I think I'd like us to talk a little bit more about how hospice has grown over these 36 plus years, especially here in the Valley.
Sure.
But we're going to take a quick break, so stay with us. We'll be right back.
Light Moments. Here's Father Tom McSweeney.
Christian Fedorov says he's not a hero, but many people in New York think otherwise. Mr. Fedorov was at a subway station in Manhattan when he saw a young woman being attacked. The robber was trying to pull gold chains from her neck as she stood there with her child, and that's when Mr. Fedorov stepped in. The attacker then stabbed him several times and got away. And when asked if he considered himself a hero, the shy and soft-spoken college student answered, "What I did doesn't make me a hero. What I did makes me a human being." New York's subway Samaritan serves as a reminder that there's a heroic human being inside each one of us. Whether through an act of courage or an act of compassion, we become more human and more fully alive every time we live up to a higher calling.
This message from the Christophers, New York, 10017.
What have you done for your marriage today?
I gave my wife a hug this morning. I told her I love her.
I did her hair this morning. I think it looks pretty good.
I cooked my husband's favorite breakfast.
I bought her an orchid.
What have I done for my marriage today? I sent my husband a love email.
I read the newspaper to my wife, and it cracked her up. She's still laughing.
What have you done for your marriage today? Make a change for the better. Need help? Go to foryourmarriage.org, a message from the Catholic Church.
Welcome back to Spotlight. I'm talking with Rosemary Antonucci about Hospice of the Valley. We know that hospice has obviously grown over these many years since its foundation in 1979 here locally. In your experience, how have you seen it grown, and in what ways have you seen that gotten better for hospice and also for those that they serve?
Well, again, I think the concept of hospice is discussed more often. We would like to see it perhaps discussed earlier in a patient's illness, because we believe we can provide a lot of support to the patient and the family, and perhaps reduce and or eliminate some return visits to the hospital. So that's beneficial. Certainly over the years, Medicare has driven part of the hospice benefit because it's actually a Medicare entitlement. And as you know, if Medicare helps pay for a service, typically private insurances do as well. I think the other thing that's so important is Hospice of the Valley is a nonprofit institution, so we don't turn anyone away, no one whatsoever. And the beauty of that, of course, is that all of the care is provided regardless if there's one insurance or no insurance.
Well, that's got to be a comfort to those who come to hospice to know that as well,
yes.
Because sometimes that financial component weighs on them as well.
It does.
Let's talk a little bit about that whole process of bereavement. We know that that's an important facet of the dying process, not only for the person themselves who's dying, but also for a family. What kind of support, you had mentioned chaplaincy support, what other supports are there for them going through this mourning bereavement process?
Well, as long as the patient is enrolled in hospice, the chaplain can be available, as well as the patient's own faith minister, whoever that may be. Upon the death of the patient, the families have the option of accepting bereavement services from our bereavement facilitators. And we do not limit that to just the patients of Hospice of the Valley, but bereavement services are actually available to the entire community. So the loss for our support groups does not have to be of a person that died within the hospice program. It may be a tragic accident that caused the death, and the family struggling on to how to deal with this death and how to move forward. Bereavement services are provided free of charge, so again, it doesn't matter hospice patient or not, and they can be provided through the 13th month after the death of the person.
Okay. Let's also talk and bring in the Mercy Health into the equation. They're an intimate part of this. How is their charism as providing health care to people in general? How is that played out in the hospice program as well?
Well, I think if you know the mission of Mercy Health, we focus on extending the healing ministry of Jesus, and certainly in hospice you do that through the very last moment of life. And then also a big part of the mission is to reach out to the community and to address the needs of the poor and the underserved. And I certainly believe that Hospice of the Valley has reached out, especially to our minority populations. And we are there to serve everyone that is accepting of our services.
One of the groups of people that oftentimes have a difficult time with death are young children.
Yes.
What are some of the things available through hospice for them, especially if their parent is experiencing the dying process?
Sure. Our social workers help identify the children while the person is still living and offer support services to the children or the parents of the children. Upon the death of the patient, Hospice of the Valley holds an annual children's grief camp. It's a 3-day day camp, totally free. Again, it does not have to be a hospice patient or a relative of a hospice patient. And we assist children between the ages of 8 and 14. And we focus on their feelings. We also align the children with similar losses. So in other words, we may have a group of children who have lost a parent, others that have lost grandparents, and maybe the third group, a sibling. And their grief is different. Children grieve differently than adults do. And thankfully, our bereavement facilitators do a wonderful job with that. They also have ongoing counseling sessions or facilitate group sessions for children within the school districts. So we work very closely, or they work very closely with the school guidance counselors as well.
I know in my experience of visiting, let's say hospice on Sherritt Road, for example, Hospice House, the atmosphere is almost you're going in someone's home.
Absolutely.
So it's not like a hospital setting that you're entering, but you feel very welcome, and I know the family feels very welcome, because it's almost like having your loved one that's dying at your home, but in a facility that's going to minister on a hourly basis to them.
Yes.
So how important is that family home atmosphere in the hospice program itself?
Well, Hospice of the Valley is unique in that we are one of the only hospices in the community that actually have an inpatient facility. There are 16 beds at Hospice House, and typically a person can come in when their symptoms need to be better managed, or more consistently managed, I should say, and we do have around-the-clock nursing care available. Hospice House itself is designed to provide a comfortable, quiet atmosphere in a non-institutional-like setting, and as you said, it's very home-like.
The other thing I want to mention, and we talked about this prior to the taping, one of my experiences of a nurse who is in the hospice house situation, who worked in another facet in the institution, found almost a new vigor and a new life working there. I think it would be different going from working in the emergency room or intensive care and going into a hospice facility where those needs are still important and your gifts are still important, but yet there's something different about it. It's almost like you're walking with this person on a journey that has this beautiful light at the end of the tunnel.
Yes.
And so I'm sure that your workers themselves are very inspired by the people that they serve. Do you experience that?
Almost every single day. What is so important, I think, is that as a person becomes a patient at Hospice House, the whole focus is to support, not to cure. You're not addressing necessarily a life and death issue. You know that this person is terminal with a life expectancy of 6 months or less. And the emphasis is being comforting and supportive care, again, to the patient and the family. So oftentimes, as we said earlier, the patient's needs are being met, but so are the families. They feel very supported.
We're going to talk a little bit more about hospice, in particular, the volunteer portion of it, and we're going to do that in just a moment. We're going to take a quick break. Stay with us. We'll be right back.
Johnsons enjoy Friday dinners out. Nothing fancy, just time together to reconnect as family. They make sure others eat as well. By giving to Catholic Charities of Youngstown, the Johnsons join other angels who care for those in need, regardless of religion or race. Show your wings with a gift to Catholic Charities, changing lives one family at a time, providing housing, emergency financial assistance, senior services, and more. Give now at ccdoy.org.
There is a place where a total stranger will give you their blood. There is a place where someone you never knew will save your child from drowning. A place where people from 7 states away will turn up at your door and give you food and shelter after a flood. There's a place where a person who doesn't look like you, talk like you, or dress like you will stretch out their hand and put it across your shoulders and say, everything is going to be okay. That place is called America, where we look out for each other, and it's up to us to keep it that way. When you help the American Red Cross, you help America.
Welcome back to our show. I'm talking with Rosemary Antonucci about Hospice of the Valley. And Rosemary, you're the volunteer manager at Hospice. Tell us about that wonderful facet of the volunteers. I'm sure they provide a lot of not only work, but dedicated effort to the organization.
Absolutely. First of all, we're blessed with almost 300 volunteers, and they can do a variety of services. Volunteers can be companion volunteers and actually be at the bedside with a patient. But we have a whole group of volunteers that also assist us with fundraising and special events. We have clerical support volunteers that are very important. Hospice of the Valley has a unique program also through our volunteers that are called Vigil Volunteers. And that specially trained group of volunteers is set up so that if a person doesn't have a family or a family cannot be present during the patient's final hours, the Vigil Volunteers are present to the patient so that no one dies alone. And that's really a special calling, I think.
It really is, and you know, there are a lot of people that are afraid to die alone.
Yes.
And sometimes there are people that want to die alone, but for those who really want someone present, it's a beautiful opportunity, and to provide that is a great thing. You had mentioned earlier on that Hospice is a non-for-profit organization, so obviously you need funding from different sources.
Yes.
What are some of those fundraising efforts that the local community could participate in? And if someone's interested, what do they do? What are some of the events?
Sure. The largest fundraising events that we host are the Mardi Gras, which is typically right before Lent, of course. And then we also benefit from an awesome Aussie luncheon, which is coordinated through the Outback. Those are the two largest fundraisers we have throughout the year. But we are also very fortunate. Our volunteer department does 2 pancake breakfasts a year. We have recently hosted one at St. Michael's in Canfield, and we will be hosting one this spring at St. Charles. Families and small groups can also host fundraisers, a spaghetti dinner, or perhaps a Chinese auction of some type. And those families that choose to do so can ask for requests in memory of their deceased loved one to come to Hospice of the Valley. And if individuals are interested, they can simply call the local number, 330-788-1992, and they can request to make a contribution that way as well.
Let's mention the website as well, because a lot of people prefer to go to the website.
Sure.
What is that?
That would be hospiceofthevalley.com, all together, all lowercase.
Now, in your experience of working with Hospice of the Valley, but also with Mercy Health, what has been the greatest blessing for you personally in your life?
Well, quite honestly, I think the opportunity to continue to serve. My background is social work, so it comes very naturally to me. And I think what's important is, and many of my volunteers will tell you this, it's a paycheck of the heart. You're able to help someone in a very fragile, vulnerable time of their life, but you can make it as positive as possible. And so often, my volunteers will say to me, I get so much more from the patient than what I give to the patient.
Now, do you find some of the people that have had loved ones die in the hospice program volunteer their efforts after? What's that experience?
Absolutely. We request that it be at least a year from the time they have lost a loved one. We need to give them time to adjust and properly go through their mourning or grieving process. But after a year, they can apply. We provide approximately 15 hours of specialized training. When they have completed all 15 hours, they come out as a certified companion volunteer. And then again, they can pick the area that they are most comfortable in donating their time back to hospice.
Do you have an age limit?
Typically 18 to as old as the person wants to be. I would say probably my oldest volunteer right now is about 86, and they have donated over 30 years of service. So that's very impressive.
And I would imagine you have opportunities to give some kind of appreciation to your volunteers as well.
We do.
What do you do for them?
In the spring, usually, or early summer, we will host a picnic at the Boardman Park, and then usually every October we do a volunteer appreciation dinner. April actually happens to be Volunteer Appreciation Month, so they'll be hearing from us shortly with a little note of thanks in particular. But again, we try to thank the volunteers each and every time we have an opportunity to see them and speak with them directly, because without them, we wouldn't be able to provide the services that we do.
Let's say that there's a parish or an institution that would like to get more involved with hospice. Is there anything that they need to do or to have in order to provide that service for you in a volunteer way? Any obligations or requirements?
Well, it would depend what their focus would be. We do have some small groups that like to provide food for Hospice House to the other families that are present. So they might make a pot of stew or bring in pasta. Because again, those families that are there are under a lot of stress, and rather than have to go out and get something at a restaurant or worry about where they're going to eat, sometimes small groups will donate food for the families. Sometimes small groups want to actually take care of the staff, so they may make a donation of some type and designate it for the staff's consumption. Typically, in those cases, the best thing to do would be to call Hospice House. They can ask for me directly, and I can try to guide them more specifically.
I'd like to talk a little bit more in our closing few minutes of our time together, in particular about the staff, because the staff are really the people that do the work, the day-to-day work. What types of staff people do you have, and what are their qualifications, but what do they actually bring of themselves to hospice?
Well, again, I think the individuals that become an employee of hospice have to be comfortable with the concept of hospice itself. So knowing that the individuals they're dealing with have a life-limiting experience or life-limiting expectancy, so they have to be comfortable with that. But I think more important, the compassion, the caring, and the sensitivity. Every situation is going to be different. Ultimately, all of our patients do die, but it's in the process that we need to support them and provide whatever discipline you're representing, the best possible quality care you can do.
Well, Rosemary Antonucci, we certainly appreciate your presence on our show today.
Thank you.
And for providing the wonderful information about Hospice of the Valley. Hospice does a lot of monumental things, too many to really count and to mention today. But we thank you for your long history in our valley and for the work that you do, especially with our volunteers.
Thank you. It's a pleasure to be here.
Thank you. And thank you for being with us. Have a good day, and God be with you.
Spotlight has been a production of CTNY, the Catholic Television Network of Youngstown. Your program host was Father James Corda.